Hi, my name is Daniel. I'm in BSN 366. I will be doing my central line dressing change. I'm going to go ahead and begin. First and foremost, I'm showing you all, demonstrating that I do not have any artificial nails, no colors on the nails. I don't have any jewelry, no rings, no bracelets, no smartwatches, nothing going past my elbows, because this is a sterile technique at one point. Therefore, we do need to be imperative that we are not introducing any type of pathogens to our patients. And by one of the biggest ways of that happening is the nurse wearing artificial nails, the nurse not removing their glove, their rings and whatnot. So I'm not having any of those. My workspace is clear from obstructions. Y'all will be able to see me during the video. So I'm gonna go ahead and begin. And Daniel set. So I'm knocking over to my patient's door. Knock, knock, knock. Hello, I'm Daniel. I'm gonna be your nurse today. Shut the door, providing privacy. How are you? Good, good. Can I please have you confirm first and last name and date of birth? Thank you so much, Miss Tina Jones. I see your first name is Tina, last name is Jones. We have a birthday of 11/15/1988. Thank you so much, Miss Jones. Now, Miss Jones, I'm going to go ahead and apply my mask. However, you have a few options because this procedure, it is imperative that we do not introduce any type of pathogens into the into the site once it's been cleaned. So therefore, would you like to wear a mask or turn your head? You'd like to wear a mask? Okie dokie. Yes, we would be turning our head or in our case, wearing the mask to prevent any type of, you don't want that area to be exposed when, you have your not wearing a mask, okay? So how are you doing? Good, good, good. I'm gonna go ahead and don on my clean gloves. Good, good. And now, Miss Tina Jones, have you been experiencing any type of tenderness, any pain with your central line? With your dressing? None whatsoever? Okie dokie. Now that once I've applied hand hygiene, I'm wearing my mask, my patient has her mask, I'm wearing my gloves, I'm going to stabilize my patient's catheter with my non-dominant hand, remove the dressing by pulling up gently one corner at a time. I'm going to be pulling straight out parallel to the skin, repeating on all four sides until the process has been complete. Okay? Stabilizing with my non-dominant hand, 1. Gently pulling up the corner and straight out and parallel with the skin. How you doing, Miss Jones? Good, good. I've repeated that process on all four sides until the process has been complete. I'm inspecting my patient's catheter for any type of abnormalities. I'm assessing for bleeding, erythema, edema. I'm assessing the insertion site to make sure that it's intact, to make sure it is patent. Miss Jones, how are you feeling about your insertion site? You're feeling good? Okay, okay. Now that it's in good shape, I will go ahead and remove my gloves and place them with the dressing into the trash. Apply hand hygiene. Next, I'm going to be opening my dressing kit using the sterile technique, applying my sterile gloves. Gently pulling up one corner at a time, staying within that 1-inch margin. especially in the middle. Bam. Okay. Next, I will be picking up my chlorhexidine gluconate, listening for that click, because that click is going to need to be, it's going to saturate the site of where the dressing is, okay? With my gauze, I'm going to use my gauze or tweezers to pick up the patient's catheter, okay? Now, I'm picking up my patient's catheter. Now I will be cleaning the sides. I will be cleaning all 4 sides of the site of where my patient's dressing was, okay? In a back and forth motion. Back and forth, back and forth, for 30 seconds, okay? Back and forth, back and forth, 30 seconds, back and forth. You can sing, I'm staying alive, because I'm staying alive in my head. That's what I'm singing. Back and forth, back and forth. We're going to get that 30 seconds because it is imperative, because this is a sterile technique. Back and forth, back and forth. And we're doing a full 30 seconds because this chlorhexidine gluconate has been saturated and we are cleaning. We're staying alive. 30 seconds. And once the site has been cleaned in a back and forth motion using friction, 30 seconds, all 4 sides, where I'm going to be cleaning my patient's catheter. I'm going to be starting with the top, and we will be starting at the top, and then we're going to be cleaning all 4 sides, never backwards, okay? We will be starting and pulling away, all right? So pulling down, down, left side, right side, lifting up the catheter, going down, cleaning, down, okay? All 4 sides have been cleaned. And we are going to apply my TSM dressing over the site. This is going into the trash can. But first we need to wait until the site has been completely dried, okay? The site needs to be completely dry, or else our TSM dressing will not be able to be applied. Once the site has been completely dried, I will apply my TSM dressing. I will go ahead and label the site, label the dressing, pardon me, with my initials, date, and the time. It looks about, well, not about, it's completely dried. My DS, today is 3. Right here. Remove my gloves. Apply hand hygiene. Miss Jones, how are you doing? You're doing okay? How does your dressing feel? Does it feel okay? Feels okay? Okie dokie. Are you comfortable? That's another important question. Are you comfortable. Miss Jones is comfortable. My patient is a comfortable position. The site has been completely changed. I have applied my dressing with my initials on there, date and time. I will be documenting the removal of the old dressing and documenting the initial assessment of the removal of the catheter, how the catheter was patent, how it had no abnormalities, how my patient demonstrated no signs of edema, erythema, how the patient had a clean and intact incision site, okay? I will be documenting that. I will be documenting my patient's tolerability of the procedure. I will be documenting the successful completion of the new dressing. I will be documenting the date and time, the nurse, who is me, and my patient's tolerability of the new dressing. Patient is in a comfortable position. Documentation has been completed. Hand hygiene has been completed. This is going to conclude my video. Thank you so much.